Full-field electroretinogram is an important objective retinal function test. Our method optimizes retinal dark adaptation to acquire valid and reliable full-field ERG responses in infants and young children under anesthesia.
Performing full-field ERG in young children under general anesthesia in the operating room improves patient safety and facilitates the performance of additional diagnostic testing.
Full-field ERG is important for detecting retinal dysfunction, including early onset inherited retinal diseases, such as Leber congenital amaurosis, in settings in which approved gene therapy and clinical trials are available.
After selecting an appropriate operating room, install black, washable, opaque, non-reflective, stain and bacterial-resistant curtains onto tracks to fully cover the operating room door and window openings without light leakage. Place translucent red filter films over monitors and opaque black tape over LEDs and other light sources, and check for unblocked light sources. Set up a portable darkroom that is easy to install and store and large enough to enclose the patient's head, ERG examiner, and full-field ERG stimulus. The back side of the portable darkroom should be modified with a small